it may be the only billion-dollar industry that no one likes to talk about. That is, until it intersects with politics and health. Experts say that 30,000 people are watching pornography at this moment. It is estimated that more than $3,000 is spent on the adult film industry every second, and every 39 minutes a new film is created. For decades, this lucrative business found a safe haven in Los Angeles, employing thousands of people and generating more than $1 billion in local revenue annually. But this might come to an end as new health regulations continue to target the industry. The Safer Sex Initiative Act, better known as Measure B, was passed last year despite strong protests from the industry. It mandates the use of condoms in porn films, and producers are now required to obtain a permit from Los Angeles County Department of Public Health. This measure applies only to incorporated areas of Los Angeles County, but maybe not for long. A California assemblyman introduced a new bill last month that expands Measure B statewide. The law would require safe work standards to protect all adult film actors throughout the state. But the porn industry is fighting back. Some porn actors are criticizing the measure, claiming that condoms are not necessary because the industry already conducts regular STD checks. They say the law is a waste of taxpayers' money. Others argue that these health regulations hurt their profit and may drive the industry out of LA and eventually out of California. But perhaps the strongest outcry is related to the First Amendment. Free Speech Coalition Diane Duke says the proposed law infringes on porn stars' freedom to do what they want with their bodies.
It's a matter of telling the government telling us how to produce our films. We have safeguards in place already that protect the performers, actually very effective safeguards. So for the government to come in and intrude on how we produce content and our expression based on content we believe is unconstitutional.
Supporters of the measure say it's not about attacking the First Amendment. It's about safeguarding public health, addressing the ongoing epidemic of sexually transmitted diseases. There were more than 47,000 new HIV infections in 2010. A quarter of these cases involved people 13 to 24 years old. Almost half of the 19 million new STDs diagnosed each year are among 15 to 24 years old. On Point Enola Yos is here and has more on this topic.
Thank you, Mona. Joining us here today, we have Mr. Marcus, who has been an adult performer in the industry for about 20 years. And we also have Carla Valdez, who is an instructor in the Department of Health Sciences. I want to flash back towards 2012. Can you explain exactly what happened?
I was infected with syphilis, and this was probably around like May. Got it treated in July, caused a panic in the industry, and you know, it kind of led to a lot of things changing. We didn't have the right, we were testing, but we weren't testing for syphilis. It was like once, it was going to twice a year, but it was only once a year at the time. And they had missed it, you know, and I went to my own personal doctor, and that's how I found out.
Having the experience of the industry for about nearly 20 years, within that span of time, how many times have you contracted
anything?
Anything.
Probably less than 5. 20 years, yeah.
Diane Duke from the Free Speech Coalition, who is not able to join us today because she is currently in Sacramento lobbying against the enforcement of AB 332. She has said that there's already a good security system in place for the performers and that we don't need to enforce this legislation for a variety of reasons. Let's have a look at what she has to say.
The CDC recommends that you test once a year for syphilis. For high-risk populations, they suggest that you test twice a year. We're testing every 14 days or every 28 days. So we're aggressively making sure that our performers are protected. So It's much easier, it's much safer to be a performer and testing than it is just somebody out in general society.
Diane Duke of the Free Speech Coalition also said that their organization does not force performers to do anything. They believe, you know, that is your right to.
Yeah, no, this is all voluntary. All that testing is voluntary. I mean, that's the protocol we use to work with other performers, is that these tests are taken, but it's not mandatory at all.
So there's a mutual trust that exists amongst performers.
I mean, there's an agreement. I mean that, you know, if you want to work, if you want to perform, you have a valid and current test, definitely.
Would you really vouch for the accuracy of that system? And
I mean, I would. I mean, I've been using it for almost 20 years, and I've seen it evolve. You know, it used to be a test that we took every 90 days instead of every 30 days, and we didn't have STD testing. We weren't testing for gonorrhea and chlamydia until about 2010. So, you know, it's one of those things that's it's just evolving. It's getting there. You know, now they test for syphilis every month instead of twice a year. But I also thought it was because also in the real world, the medicine and the knowledge in that world, we catch up to that. You know what I mean? As they got progressively better with testing methods, then we would take those methods and apply them to our industry. Okay.
So what exactly is it like to be a performer on set? Now, does the producer, you know, collect all the testing results, or?
Well, there's two different ways. There's a APHSS system that's pretty much it's like a collective where everyone's test results go into this database, and it's accessible to other performers and, well, mainly producers. And if you are a producer director or performer director, you get access to that information as well. And then the other one is just showing up with a hard copy of your test and showing that to your performer or other producer.
How did the producers trace the syphilis outbreak to you, the contraction? Because if there's a security system in place and, you know, it's supposed to be confidential to an extent, how exactly were they able to trace that to you? Because I think that, you know, there's been a lot of criticism as to how they could possibly trace that to you alone,
right,
as a performer.
Yeah, I mean, as far as I was aware, there was no outbreak that resulted from me at all. You know, and I kept tabs on everybody. I kept calling people, and every performer that I worked with, the girls, before treatment and after treatment, had continues. They were all tested and retested, and they were fine. So I think as far as tracing it back to me, there's never been anything to support that.
Just as far as the overall treatment, the dynamics on set, you know, are women like disregarded in any sense? You know, because there's been a lot of media attention as far as women only lasting 3 months in the industry and then kind of being discarded and really having the backhand as far as contracting sexually transmitted diseases because of the impact of the scenes that they're taking.
No, that's
when
good.
Performing.
No, that's a good question. I don't know of any females that, because I don't know how they deal with, from what I've heard and experienced, you know, when it comes to an STD, most women and men handle it personally. And they usually stop performing for a certain period of time to get it treated, and then they come back to work. I don't know if there's anything where they get discriminated against or treated differently. I mean, I don't really know who passes it more. You know, I'm not sure if it's more of a female thing or a male thing. I just know that, you know, it goes around and comes around, you know, unless it gets treated. I wouldn't know. I wouldn't know how, if females, I just know that once they realize they've gotten something, they stop working and get it treated.
There's also been some speculation that it's a major problem with crossing over from, you know, homosexual to heterosexual in the industry. So what's your take on that?
I mean, I think that that's where some of our problems are rooted in. I think when male performers go back and do gay and bi and come and do straight, I think they're just kind of connecting the dots. They're just bringing whatever in the gay industry into the straight industry. And I think the same thing with women. I think when they do, you know, bisexual scenes or they work in the gay industry and they come and do straight, I think those open up doors to a lot of problems.
In the gay industry, like they aren't checked when they test positive for HIV. They can continue working in the industry. Is that?
Yeah, I've heard different things. I think it's a known fact that if they're HIV positive, they usually work with other HIV positive performers. And I think they also enforce condoms there, but I'm not sure how frequent and how often on gay sets. But I've heard that through just discussions that, yeah, there's a higher number of HIV performers, but they go and perform with others knowing that.
You didn't give up on sex. Don't give up on birth control either. There are more methods than you think. Find yours at bedsider.org.
Oh, those boys are much too much. Those boys are much too much. We got the spirit. We're hot. We can't be stopped. We got the spirit. We're hot. We can't be stopped. We're going to beat them and bust them.
The smallest moments can have the biggest impact on a child's life.
Let's get a little bit rowdy. R-O-W-D-Y.
Take time to be a dad today. Call or visit fatherhood.gov to learn more.
So, are you going out tonight?
I can't. My parents say I have to be home right after work.
That's so gay.
Totally gay.
Ugh, that is so Emma and Julia. Why are you saying that's so Emma and Julia?
Well, you know, when something is dumb or stupid, you say that's so Emma and Julia.
Who says that?
Everyone.
Imagine if who you are were used as an insult. When you say that's so gay, do you realize what you say? Knock it off.
Turning a 20-foot wall into a canvas takes vision. So will getting into college. I've got what it takes. So do you.
Beyond syphilis and HIV and AIDS, what other sexually transmitted diseases are susceptible to, you know, the general population and the youth? Carla, if you could answer that.
Sure. That's a really good question. There is a lot of focus on HIV infection, and rightly so. That's a very important and serious infection. And I think one of the bits of information that is maybe lacking in the general population, particularly among young adults and young adolescents, for example, would be information around chlamydia and gonorrhea. And those are two reportable infections that have a high incidence and prevalence rate in our community here in Los Angeles, especially among 15 to 24-year-olds. So the CDC estimates that there are about 19 million new cases of STDs every year in the United States. And when we start to look at the distribution of disease, we start to see some trends that highlight young individuals between the ages of 15 and 24. So out of those 19 million new cases, about half, just under half, occur among 15 to 24-year-olds. And the two that are highest are chlamydia and gonorrhea, which are curable infections, but oftentimes do not have symptoms, and so they are very easily passed from one person to the next if someone isn't using condoms or other risk reduction strategies. If someone isn't getting tested, they may not know that they have an infection like chlamydia or gonorrhea. So those are two infections that are serious but tend to have not as much information out there. People are a little bit underinformed, I would say, about those two infections.
What are the sources available for treating these types of infections, or information that's available to the general public, you know, in regards to this issue?
Well, there are a number of, really important websites that people can go to for information. And, people can get tested for chlamydia and gonorrhea at a number of different sources within our community, at just regular primary care physician offices. Most of the time, the capability for testing is there. Community clinics, for example, other types of family planning organizations that provide testing, those are easily accessible in our community. Here on campus, for example, our student health center is available for testing and treatment for our student population. So there are many resources for information and for testing, and it's just about letting people know where those resources are and helping to get those connections. I think one of the barriers to care often is that people think that maybe that they can't afford it, for example. But there are some important programs in our community to help provide individuals, men, women, and teens, with family planning information, services like STD testing, health exams, contraception, for example. We have a program in the state of California called Family Pact that people can apply for to have those services covered. Another issue I think that's a barrier is the concern around confidentiality, but these are tests that people can go and receive receive their confidential services. So there are resources out there, definitely.
Okay. How exactly does the confidentiality agreement work? Can they go to seek advice from physicians without their parents being informed, or if they're underage, do they?
Right, that's a good question. So in the state of California, minors can access services for testing and treatment for STDs. They do not need their parents' permission or consent, but one of the things that is a really important practice is making sure that families, parents are informed about these issues so that teens can feel comfortable to talk with their parents or another trusted adult to get guidance and to get support when making decisions around their health and sexual health questions, for example. So teens can access services confidentially, but one of the things that would be, in my opinion, very important for teens in general is to make sure that we are providing young people with the correct information, accurate, factual information at home, at school, in the community, so that we are helping young people to make informed decisions.
Great. Mr. Marcus, I'm going to ask you in regards to this. Do you feel that your confidentiality was breached in any way during the time of these alleged accusations that you forged your results? And, I know that you received a lot of scrutiny, but after all, you're a human being, so how did you feel at the time?
I mean, at the time, I felt like, what the hell is going on? I was like, I wanted to deal with it privately. And I was challenged by the fact that I was in a professional environment, and whatever rules had been changed, I couldn't remain anonymous. I couldn't, and unfortunately, that's what happened to me. But fortunately, there's a lot of performers in the industry who get to remain anonymous just because of that confidentiality, that medical privacy that's allowed to each performer. The way it works with the APHS system is that there's just a performer is either green lighted to work or not. I mean, it doesn't say what's wrong with them or if anything has come back positive or not. It just says available to work or not available to work.
Do you believe that you received enough information as far as sexually transmitted diseases?
No, I mean, at the time, you know, you would think, being in this industry, I would have known what syphilis was all about, but I didn't. I did not know about it, and I didn't know. You know, I was on the internet scouring it, asking different people. You know, I went to, after my doctor told me what, you know, what I had, and I got treated, I still was looking for more information about it because I was just curious about, you know, how you know, and there's just a lot of just misinformation. And at the time, syphilis was one of those things that was just starting to emerge across the nation. There was a rise in new cases. So there was, what I was able to gather was that there were doctors seeing symptoms for the first time and really didn't know what was going on as well. So it was an educational process for everybody.
Do you feel that, because research has shown that most of the viewers that are watching porn are in adolescent stages of life, between the ages of 12 and 17. Right. And as a performer and someone who's been in this industry for so long and seemingly has a lot of influence, do you believe that it is the responsibility of the producers or your responsibility as a performer to uphold this type of security and, you know,
right,
the impression?
Well, I mean, I agree that as performers, we're responsible to some degree, and I didn't, once it was out, I mean, it was like, what am I gonna do, going back underneath the rock? I was already an outspoken performer, so then it just became about, all right, well, you know, let me share the experience, and, you know, without someone having to go through what I went through, but get an idea of what it is, you know, in our industry, how that affects us and symptoms to look for and stuff like that. And so, but yeah, I think in responsibility, I can't be responsible for everybody's sexuality and what they do. You know, I can just, like you said, just try to educate them better in the process.
Professor Valdez, do you think that most college students take the proper precautions as far as preventing the transmission of STDs?
That's a really good question also. You know, I think that in general, there tends to be some knowledge out there in our community, in our college community here. I hear it from my students. But there also tends to be some misinformation. So I would say, do they have everything they need, or are they equipped to be, are college students equipped to be making prevention decisions? I would say yes, but we probably need to provide a little bit more information first. So I think what I would talk with college students about now is understanding that they are in an age group with high rates of certain types of infections. And so it's something that I really think that young people, young adults need to be playing a more proactive role in their own health and taking some positive actions to prevent STDs in their own life. So choosing a partner carefully, deciding to use protection every time they choose to have intercourse, talking with a partner about when the last time testing took place, making sure that they get tested on a regular basis, making sure that the person understands what are some common symptoms. You heard me say earlier that chlamydia and gonorrhea most of the time do not show symptoms. Those are infections that are asymptomatic. But we do know there are a list of commonly reported symptoms, such as unusual discharge or painful urination, bleeding with intercourse, or bleeding between periods for women, for example. So understanding what are some of the common symptoms, but not just relying on, I feel good, I look good, because many times there are no symptoms. Using water-based lubrications with intercourse, for example. Making sure that the person takes active steps to get tested on a regular basis. So I would say that it's just about getting a little bit more information out there, making sure where students know where to get the information and where to get the services. And I think most individuals have an interest in protecting their own health, and it's just about giving them the right tools and resources to do that.
Mr. Marcus, I want to thank you so much for joining us here today. And Professor Valdez, I want to thank you for coming.
Thank you.
Thank you.
give up on sex, don't give up on birth control either. There are more methods than you think. Find yours at bedsider.org.
Come on, let's go.
Just a minute, I gotta finish this.
Wait, you're gonna post those pictures of Mary?
Yep. She thinks she's so hot.
But her mom and dad will see them. Her grandmother, her little sister, everyone she knows, it's gonna kill her.
Who cares? Just a couple of pictures. It's no big deal.
No big deal? Don't. This has gotta stop.
The smallest moments can have the biggest impact on a child's life. Take time to be a dad today. Call or visit fatherhood.gov to learn more.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
Over 13 million people are affected by famine, war, and drought in the Horn of Africa.
Make a simple text donation of $10.
But do more than donate. Forward the facts.
We would all like to thank you for tuning in to On Point. If you would like to see more of this, you can follow us on Facebook by searching CSUN On Point and follow us on Twitter at CSUN On Point, all one word. This show also appears on our website at CSUNTVnews.com or catch us here every Sunday at 4 o'clock. For Aniola Yos and all of us here at On Point, I'm Mona Adem.